Next topic, that is on a management of residual refraction after trifocal IOL implantation using SMILE surgery. The chief presenting author is Dr. Faruk, SEMIZ.
Hello, my name is Dr. Faruk SEMIZ. I am from Turkey. Management of residual refraction after trifocal IOL implantation. Why carry out this study? Residual refraction is one of the biggest causes of postoperative patient dissatisfaction after cataract surgery. This study aimed to provide evidence to support SMILE as an alternative and comfortable option both patients and surgeons for improving both the visual outcome and patient satisfaction. This study published Ophthalmology and Therapy 22. This study includes 82 eyes, cataract surgery with size trifocal IOL implantation, underwent cataract surgery at various clinics between 2017 and 2018. YAG laser capsulotomy with or without posterior capsule, opposite 3 months after cataract surgery. SMILE surgery was performed 1 month after YAG laser surgery. Patient with hyperopia less than 23 millimeter axial length. The patient had residual myopia between -1 and -2, 25 dioptry, astigmatism -0.75 and -1.75. Excluded patient with history of high myopia and pre- and postoperative evaluation we did mesopic and photopic condition. This is a SMILE surgery, pseudophag patient. And interstomal pocket we prepare first, and cup thickness every time I use 130 micron. Femtosecond laser sport energy 130 nanojoule. 1 minute take for me, easy. For this reason I use this procedure. Results and Q value increase 1 year after, and visual acuity increase. Pre and postoperative RMS and Q values. Post-op RMS decrease, Q value increase. Near visual acuity. In this study, we benefited from this feature of the trifocal lens and increased distance and intermediate vision ratio without compromising the comfort of near vision. The study highlights 2 important concepts. Success was achieved by maintaining a balanced approach, avoiding excessive increasing in the Q value and preventing excessive reduction in total RMS. SMILE technique is a safe and effective treatment modality for pseudophag myopic fracture to improve the visual outcomes and satisfaction of patient after cataract surgery. Thank you so much.
Thank you so much for this presentation. Just one query. I think you said your patient would have undergone YAG capsulotomy maybe after 3 months of surgery.
Yeah.
And after 1 month of YAG capsulotomy, you went for a SMILE in these cases.
Yeah.
That means approximately 4 months after the cataract surgery. Why didn't you do it before YAG capsulotomy? Why did you do YAG capsulotomy in these cases?
10 years ago, I started.
Because they had a significant residual error of ranging from -0.75 to 2.75 diopters. And YAG laser, I don't know why you have done a YAG capsulotomy in these cases.
10 years ago, I started this procedure. First, I start not include this in the no YAG laser did. And after that, some residual refraction coming in the for the season, and I do YAG laser.
So what was the smaller refractive error, that lowest refractive error you have corrected in this?
Normal SMILE surgery, no different.
Lowest, -1, -0.75.
I start -0.75 small, and high.
Because you have used, Bijumex 500 in this particular case.
Yes.
So you are comfortable using this system for a minus 0.75 because lenticule will be very thin.
Yes.
You are comfortable there? To remove the lenticule sometimes
Yes.
it can be very tough if you have a very thin lenticule. Because
No.
0.75 is a very small
Yes,
myopia.
very small. No problem for me. Every week I do this procedure.
And you had quite a significant cylinder also, range from
Yes.
0.75 to 1.75 diopters. Do you think 1.75 is can be corrected with a SMILE procedure, or you would have done other procedure?
Yeah, no problem for me.
No problem.
No
Okay.
problem.
Any questions? One question from the house. This is an interesting series of cases. Post-cataract surgery, trifocal lens, Zeiss Atriliza has been put. After that, they had a significant residual refractive error, which you all know can be corrected by various procedure. It can be PRK, LASIK, or SMILE now. And yes, one question.
I have a similar question which I don't get answer to.
Yeah.
YAG with the PCO is okay, but YAG without a PCO, I mean, why was YAG done even if there is no posterior capsule opacity?
If I understand, his answer was even once you do a YAG capsule, there may be some refractive error coming up because maybe because the lens effective lens position might change. So it is better to do a refractive correction after whatever happens, then you do a refractive correction. Yes, that was his idea. So that opens the posterior capsule, which is not very good idea sometimes, especially a multifocal, trifocal lenses, because we tend to blame the posterior capsule for sometimes the complaint from a patient, and we open the posterior capsule sometimes without any necessity. But it's a good concept.